welcome everyone. The AOT Learning Network is back from summer vacation and really excited to get going this year. We have some changes that happened over the summer. As most of you know, Brian Stetton, who was our fearless leader for many years here at the implementation team, has moved on to New York City and to as an advisor to the mayor. And we have brought on Brooke Gentry as our implementation coordinator. And her job is to keep Betsy and I wrangled and moving in the right direction, organized. And she's been with us for a little over a month now. And Brooke, would you like to introduce yourself?
Sure. Like Amy said, my name is Brooke Gentry. I come from another nonprofit, and I am working towards getting Amy and Betsy wrangled. Can't say it's 100% right now, but I'm really happy to be here. And you probably will see, emails from me in the future, stuff like that. But I'm happy to be here and glad to be part of the Learning Network and meet all of you.
And I didn't start by introducing myself. I'm Amy Lukes. I'm a social worker and here at TAC, and I am now the director of AOT implementation. Betsy?
Good afternoon, everybody. Welcome to the third Thursday webinar series. The name of our program today is NAMI Programs Make a Difference. For those of you who I haven't met, my name is Betsy Johnson, and I'm the AOT Policy Advisor on the implementation team. And I'm fortunate to have such great colleagues in Amy and Brooke. So whenever community leaders reach out to our implementation team and ask for advice on how to get a program off the ground, the first thing we tell them is that they need to get buy-in from the key stakeholders. The first key stakeholder that we tell them to reach out to, if they haven't done it already, is their local NAMI affiliate. AOT programs that involve NAMI at the very beginning of the process and keep them at the table throughout are often the most successful programs. There's three reasons for it. It's in case the community about mental illness and available programs, including assisted outpatient treatment. They provide support to families and individuals living with serious mental illness, including those on the AOT and the AOT program, and the families and other loved ones that support them. And they advocate for quality programs with key decision makers, including assisted outpatient treatment. So we are thrilled today to have two representatives from the National Alliance on Mental Illness in DC with us today. We have Susan Cabin, I'm sorry.
Cabin.
Okay. Who is a director of the National Education Programs, and her colleague Anita Heron, who is the senior manager for NAMI Family Programs. So we're going to ask them they'll present for about 45 minutes, and then we'll ask you to, if you have questions as they come up, just go ahead and write those in the chat box. And then at the end, we'll have an opportunity to ask those questions. So ladies, thank you so much. Welcome. And we're really looking forward to hearing what you have to share with us today.
Thank you, Betsy. Thank you so much for having us. So here comes the first, what is this? 30 seconds of anxiety where you go to share your screen and you hope it all works. So everyone send good juju. And can you all share my screen, or if you just raise your hand? Oh, great, great, great. And then slideshow from the beginning. That was easy enough. As Betsy introduced, I'm Susan Cabin. I'm the national director. I'm the director of National Education Programs, and I'm here with my colleague, Anita Heron, who is the senior manager of Family Education Programs. And you'll hear her. She has been with NAMI. She's the veteran on our team, our current team. She's been here for 5 years. I myself have been with National for 13 years, However, I have been with NAMI at the affiliate level and at the state level for the past 20 years. So hopefully I don't look as old as that sounds. What we're going to cover today, we'd like to describe what NAMI signature education programs are, and those programs also include presentations. We're going to identify and discuss the 12 NAMI signature education programs and presentations. And then we're going to identify the 6 evidence-based NAMI signature education programs and presentations. So what do I mean when I'm talking about NAMI signature education programs? Our programs are developed by experienced professionals, and we use the best available scientific and clinical information and teaching models. We also value the input of people with lived experience. So none of our programs are ever created without some sort of advisory group, making sure that we pay attention and value that voice. So with our NAMI programs, what they do is, of course, first and foremost, they inspire hope. And we do that through shared stories of recovery and resiliency. All of our programs and presentations are led by peers. So people with similar life experience, whether that be family members, whether that be an individual with a diagnosis, or mental health professionals. We also provide current information about mental health conditions and treatment options, teach communication and problem skills in our classes. Again, promote resiliency. Self-care is a very big one in all of our classes, and self-advocacy. We value, as I said, the perspective of each participant and their voice, and they promote inclusion. Some of the things that you'll see, and these are common throughout our programs, is that in order to participate, you don't need to have a formal mental health diagnosis, or your loved one doesn't need to have a formal diagnosis. All of our programs, all of the programs that you're going to hear about today are free to the participants. And it's not just sitting in a classroom and hearing somebody lecture. Everyone goes home with some sort of manual. Some are bigger than others, but we've been lucky to be able to provide those classes and all of the resources for free to the participants. As I said earlier, programs are all peer-led, and so that the leaders speak from a perspective of an equal and not somebody who's talking to them, but with them. We use the train the trainer model, and our trainers for our programs complete an intensive training so that they receive certification. And with that certification, they can go on to train new peer leaders to offer the programs all throughout the country. And again, our trainers are people with lived experience, not professionals, unless the professional has lived experience. Leaders are screened and then trained for their role. And all of our programs are built around standardized manuals. Information is presented in an accurate way, in a structured way, so that the learner is really taken through a process. Sometimes people feel when they start our programs that it's so much information at once. And then when they get to the final class, they're like, I see, you were building this upon, whatever my mindset was before I entered it. I can see all the steps that you put in place to help me form my opinions and dispel myths and stereotypes. So with our signature programs, these are our classes. These classes, they offer information, resources, and most importantly, a community of support. Most people don't know about NAMI until they need it. And mental illness, as you know, is not something people walk around just talking about. They usually keep it to themselves. And when they finally find others that are in their own position, that's when they know that they're not alone and they can share their lived experience. So all of the classes, they aim to increase understanding of mental health, improve the coping skills, and then to empower the participants to advocate for themselves or their loved ones. And each course is designed to meet the specific needs of its target audience. And these are the logos of our classes there. And with that, I'm going to turn it over to Anita.
Thanks, Susan. So the first family education program, the oldest, I should say, or the most seasoned is NAMI Family to Family. NAMI Family to Family was written by Dr. Joyce Berlin and has been around since the 90s. So it's the oldest program, and our other, I'll talk about our other education programs in a moment, but they're all based off of family to family. So who gets to participate in family to family? The audiences are families, as they say, partners, friends of adults with mental health conditions. And that adults is important because we also have a program we'll talk about in a few minutes for parents of children. So NAMI Family to Family, I'm very happy to say, has been translated into Spanish. 2022, so we have brand spanking new manuals for the De Familia de NAMI program, which we're very proud of. And soon we'll have the Mandarin translation. I really released probably, I believe it was October. I can't remember. I just talked about that last week. So it's an 8-week course, and the 2022 material is, we call it 8 weeks with an optional 9th week meeting or celebration. So the 8-week course covers problem solving and communication. We have activities that it's funny because sometimes the family members get embarrassed because communication is not as easy as we may think it is. We do I statements, reflective responses, and things like that. And you see the family members, a lot of these concepts are very new to them. So they're very nice to, to teach. And we talk about taking care of yourself and managing your stress. A lot of times in family to family, we ask, what do you do for self-care? And 9 times out of 10 people will say, I don't have time. So we'll give them pointers on something they can do in less than 2 minutes and less than 5 minutes for self-care. We, very important, talk about supporting your loved one with compassion. You know, how many times do we get angry when someone with mental health condition does something that we weren't expecting? So we teach about supporting with love and compassion. It's very important, finding your local resources and service and using them, taking advantage of what you have in your local area. And up-to-date information on mental health conditions. We have a wonderful research team here at NAMI that we didn't have years ago that keeps our material up to date on mental health conditions. How to handle crisis. We have a standalone crisis file for families to fill out and keep handy in case there ever is a crisis. And again, with the research department, we stay current on treatments and therapies. And we also talk about the impact of mental health conditions on the entire family. You know, you might have this family member that has a mental health condition, but what about the rest of the family? What is the impact on them, and what can they do, and what can you do to help support them? So next slide, Suzanne. So like all the education programs I'm going to talk about that I manage, they are evidence-based. What does that mean? That means there's been research done and findings that show the programs leave families and participants with information that they continue to benefit from the programs long after they've taken them. Some of the things, Dr. Lisa Dixon, who was on the NAMI board, did a lot of the research for NAMI, and with her research on family to family, as you can see, it showed there was significantly greater overall empowerment. And that's what we do. We want to empower our families, and greater knowledge of mental illness. I know when I first came into the mental illness realm with my son, I knew nothing about mental illness. Coping skills, higher rate of coping skills. That's so important that we learn how to cope. Lower ratings of anxiety related, to being able to control conditions, higher reports of problem solving skills. There again, we talked a little bit about the communication. People learn to communicate and in a more calm, quiet environment. And this is really what's important to many of us. This is a 6-month follow-up with participants showed the effects were still in place. I have met people who took our programs years ago and say, I remember taking this and I use this still to this day. So that's extremely important, is the long-term positive effects of NAMI programs. All right, Susan. Let's move on to NAMI Basics. So this is the program that brought me to NAMI when my son was in a locked treatment facility when he was 11 years old. I learned about NAMI Basics in 2008 when it was brand new. It was piloting in North Carolina. So the audience at the time was parents like my husband and me, guardians, whether that be foster parents, your aunts, uncles, grandparents, anyone raising or helping raise children. And we like the word youth, ages 22 and younger, who experience mental health conditions. Typically the children, they don't have to have a formal diagnosis, but they typically have shown symptoms before the age of 14. And that's the difference when you look at NAMI Family to Family and NAMI Basics. I'd be happy to talk further about that with anyone who may have a young adult who may be like 21 and not be sure which program is best. We do have Basics on Demand, which is identical to the in-person program. It's online, it's self-paced. We do have judges, court systems, and social work programs that allow NAMI Basics on Demand to be if a parent is ordered by the court to parenting classes, they do accept NAMI Basics on Demand as part of their treatment plan. So we're very proud of that. NAMI Basics also is translated into Spanish, and it is a 6-week course. As Family to Family is a 8-week course, NAMI Basics is a 6-week course. And again, we talk about the impact of mental health conditions on the whole family. When you have a child in your home, a youth that has mental health conditions, how does it affect the rest of the children in the family? We talk about the different professionals and the available treatment options and therapies. Those can be pretty scary for parents. A lot of times all they know is old movies and they don't know about updated, real treatments. So we go over that with a fine-tooth comb. We talk about the mental health care system, which is different in every state, maybe even your counties in your states. There's one class 5, that we actually provide local state-specific information. We talk about schools, the IEPs, the 504s. We talk about the juvenile justice system, which can be very scary, but it's very real. Some of our kids do end up there, like my son did. And then how to advocate for your child's rights at school. We see parents go in for IEPs scared to death and just sit there and cry because they don't know how to advocate for themselves. So we teach them that NAMI Basics. How to prepare, just like NAMI Family to Family has the crisis file, NAMI Basics also has a standalone crisis file for parents. And we also talk to the participants about the self-care. And these are typically the participants that say, I don't have 5 minutes to do self-care. So we have a really, really long list that we like to share with them on the little things that you can do for yourself that you don't realize are self-care. So. All right, Susan. So again, NAMI Basics is evidence-based. There's been a couple of studies. There's 2 here, and I believe we've had 3, if I'm not mistaken. In 2008, there was a study. I'm not going to read the whole study to you because Susan will provide the slides. And then the most recent study, which was going on when I came to NAMI, to the national office, was the one that was done at University of Texas in Austin. And it just, simply, like I said, was NAMI Basics improve parent and caregiver activation and engagement sorry, I'm getting tongue tied, decreasing children's symptoms. So the studies around NAMI programs have been positive, and yeah, so I'll stop on that, the evidence base, because there, like Susan said, I could talk about that forever. So we'll go ahead and move on to NAMI Homefront, Susan, and then if people have questions at the end, we can answer them. So NAMI Homefront, this is the program that brought me to the national office. I was brought on to be the program manager for NAMI Homefront because of my military family experience. I was born into the military. My father was a very young buck sergeant in Guam when I was born. He was 21 years old, and he retired after 26 years in the Air Force. And then, although I swore I would never date a military guy, in my defense, I met my husband and I didn't know he was in the military because he was coming off a leave and he had long hair. So I thought, oh, this guy's kind of cute. What do you do? And he said, I'm an editor to the newspaper. I thought he meant this Colorado Springs Gazette. He meant the Mountaineer on Fort Carson, but by then it was too late. So that's my story, and I'm sticking to it, of how I married into the military. And he just retired 3 years ago after spending 28 years in the Army. And so that I'm very much in tune with this program. I know nothing but military life. So our audience for Homefront, NAMI Homefront, are families, caregivers, and friends of military service members, veterans with mental health conditions. And, you know, we use the term family. I didn't say this for family to family, but we use that term loosely because, you know, sometimes family is who we make, who we bring into our lives, right? So the 6 sessions, like NAMI Basics, NAMI Homefront is 6 weeks long, 6 sessions long. Again, we learn to care for ourselves and manage our stress. When our service member comes home from deployment, there is some pretty severe stress sometimes that goes on in the house. And then we learn to support our family member with compassion, you know, instead of anger. We support with compassion. Then we learn about federal, state, and local services. Some veterans or some service members come back and that was their first time coming in the military, and then they come back from, you know, Afghanistan or Iraq and know nothing about the federal services and services available to veterans and service members. Again, we have this fabulous research department, so we stay informed on the latest research, information on mental health. We talk a lot about PTSD, post-traumatic stress disorder. We do stress in NAMI Homefront that it's not just war related. Other people that have PTSD, so we talk about that. We talk about traumatic brain injury. We talk a lot about substance use because sometimes our service members come back and instead of taking mental health medication, they use substances to self-medicate because they don't want that stigma of being on mental health medication. We talk about current treatments, evidence-based therapies, and navigating. We also have a crisis file in NAMI Homefront as well. So lots of crisis management in our programs. And again, we talk about the communication. That is actually a really fun class in NAMI Homefront because believe me, us military families, we don't know a lot of I statements and it's a lot of you statements. And so that's one of those, we hear a lot of aha moments from the communications class. So, all right, Susan, if you want to go. So NAMI Homefront is also evidence-based. We have Dr. Dixon, once again, did a research study. At one time, NAMI offered Homefront classes online because we were finding that it was very hard for family members to make it to in-person classes. If they had a service member veteran that required 24-hour care, a lot of them were very young families with lots of little ones running around and weren't able to make the in-person classes. Plus, if their service member was still active duty, their service member didn't want them out in public at a class around mental health. So NAMI offered it online and it boomed. So we had lots and lots of participants. And Dr. Dixon's study showed that between the in-person classes and the online classes, the participants still benefited from having it online. And this was before COVID. This was when people were like, I don't know about this online, training and classes and whatnot. So I'm very proud of that, that NAMI took the initiative to move NAMI Homefront online. And the newest, most exciting thing is NAMI and the Department of Veteran Affairs have partnered. We have what's called a memorandum of agreement. If you hear us say MOA, that's what that means. It's an acronym. And it's an agreement. Well, I'll just read: mutually beneficial manner to advance and improve the quality of life for our nation's veterans. So this is a law that was written, and the VA has to do this, has to have a program for their family members, and they chose NAMI. They chose our Homefront program. So we're working very closely. If you want to look it up, it's online. It's called the Compact Act. We're working we have 5 pilot sites we're working with, and training new leaders, training new leaders. And this is an exciting thing that I have been waiting for 5 years to happen. So, all right. So Susan, we can move on from there because you know me. So NAMI peer-to-peer is another one of our family education programs, not one I manage, but NAMI peer-to-peer. The audience for peer-to-peer is adults with mental health conditions who are looking for a better understanding for themselves in their recovery. I've heard really good feedback about this program as well. It's an 8-week. So you have family to family that's 8 and peer-to-peer that's 8 weeks. Okay. And it sets a vision and goal for the future, partner with your healthcare provider, sharing stories. NAMI folks love to share stories. At first we seem a little reserved, but then we love to share our stories because it strengthens relationships with your peers and your fellow participants. Enhancing, again, there's those communication skills, enhancing communication skills, and learning about mental health treatment options. So let's see. NAMI peer-to-peer is also evidence-based. This study, and I'm not even going to try her name, so I'm going to say Dr. Kristen. Her study showed that NAMI's peer-to-peer program decreased stigma. How much better can you get? Decreased stigma regarding mental health conditions and improved recovery outcomes for participants. So that's really cool. And I did want to mention this at American Journal of Psychiatric Rehabilitation. All the studies we're mentioning here, you can find them online, or I'm happy to send out copies of the articles. And then an evaluation of participants by the University of Maryland found improved self-image. I mean, how important is that to your own self-image, right? And increased self-motivation, improve relationships, and willingness to help others with mental health challenge. That's truly a peer program. And let's see, our next program is NAMI Provider. I actually managed this when I first came to NAMI, but now we have a wonderful senior manager, Darren Nelson Souza, managing it now. So the audience for NAMI Provider are healthcare professionals and students, designed to expand participants' compassion. So this program, it's 15 hours in service. And then I think I might be thinking of something else. I don't want to say what. I thought there was a 4-hour, but I might be thinking of something else.
They are just introducing the 4-hour.
Okay. So I wasn't sure if my head was in the right place. Okay. And on a personal level, one of the reasons I love this class so much this course, it's given to professionals. And when you look at mental health professionals, once they get out of school and they've been practicing a few years, sometimes they might lose that empathy piece. And this is a very good program to teach and remind them to have that empathy piece for the families. And it's an in-service training. The course goals expose mental health staff to the emotional stages people are affected. Okay, the emotional stages. It helps them gain an understanding. Oh, there's that word empathy I was looking for. Understanding of and empathy for their clients' lived experience, especially in treatment. And then to promote the concept of collaboration between the clients, the families, providers, so that we all have the best level of recovery possible. That's extremely important.
One of the things, Anita, if I could just add, is the
Yeah.
team that actually teaches this. And somebody had asked in the very beginning when I had said mental health professionals. But if you see, this team consists of an adult that has a mental health condition, a family member, and then a mental health professional who is also a family member or has a mental health condition themselves. So it's just not a mental health professional. They have to have some sort of lived experience.
Thank you, Susan. So, and again, NAMI provider is evidence-based. And so I can say this name. So in 2020, which wasn't that long ago, right? Dr. Jarrett Tucker published results of a study on the pilot of offering NAMI provider for third-year medical students. The results showed significant improvement in attitude towards the field of psychiatry and intention to deliver compassionate treatment during acute psychiatric emergencies. I'm sure many of us have heard the horror stories of non-compassionate, non-empathetic providers in the past. So this program, again, is extremely important.
It's also this program, I don't know, has really just exploded within the last 8 months.
Mhm.
Several universities, including DMU, who is actually doing a study on that and is bringing it now to their social work students, their med students, and their psych students. So there'll be parts that are actually written specifically for those groups. And it's just some exciting things that they're recognized as, that we're just looking to train as many individuals now so that we have the capacity to offer this program to all the universities now that are really asking for it.
Yeah, absolutely. So I'm going to turn it back over to Susan to talk about NAMI presentations.
So the presentations, it's what's the other half. We have classes and then we have presentation programs. And really, all of our presentation programs, what the focus on is, to change the attitudes, to change what people think about mental health conditions and how people get, I love that word, get mental health conditions, and how individuals that have a mental illness are viewed. So in the presentation programs, they convey that treatment can work and recovery is possible. They humanize perceptions of mental health conditions, and they emphasize that mental health conditions are no one's fault. And also, when we talk about recovery is possible, through these programs, you begin to see that recovery is it's not linear. It's not the same journey for everyone. So you begin to understand, what does it mean when someone is talking about recovery? And these are our 4 presentation programs: Ending the Silence, In Our Own Voice, Sharing Your Story, and NAMI Family and Friends. So NAMI Ending the Silence, what is it? It's awesome. Let me just say that. I have presented, I have spoke. It's the engagement that you get with the students is incredible. So it's a 50-minute presentation. It's a prevent and early prevention presentation. And not only is it, there's a presentation that's specific to youth students, and that would be high school students and middle school students right now to 6th grade and up, I'm sorry. School staff, there's one specific to school staff and one specific to parents, where we discuss mental health. And the best part of this is the dialogue, when the audience has a chance to then ask questions of the family members and the individuals who are presenting this. We also present this in person or virtual. We've just come up with a for rural areas or areas that maybe where there isn't a NAMI that can come and do this presentation, we can also offer it virtual. And again, as I said, there's the 3 audiences, and they're presented by a young adult who's in recovery that has a mental health condition. And this is the key to this program. Usually a family member does a presentation, which is informing them about warning signs and, how to speak to someone who might be having a crisis, or where to go, how to speak to an adult about maybe what you're seeing. But when they start to listen is when that young adult gets up and tells their story. And generally it's their story about all the things that they was happening to them in high school, and maybe how people didn't listen. And all of a sudden those kids that were sitting like this are now answering questions, waiting in line after the presentation to talk and say, that's what I'm going through, or that's what my friend's going through. How can I talk about it? It's just, it's an amazing program, and the things that I've seen that have come out of it, where schools then take on even more mental health awareness events, is just amazing. And again, so the goals is to learn the early warning signs, what to do if someone is showing signs, which is, talk to an adult. That adult doesn't hear you, talk to another adult. And then through the discussions, again, the young people realize this is happening to others. It's not just me. I'm not strange. It's not my fault. And again, dispelling myths and stereotypes. I always love when we ask you, what do you think of when you think of someone with a mental illness? And they're like, oh, it's the guy under the bridge. It's the person that's talking to themselves. And I love to always go, it's me. And I say, that I have anxiety disorder, and people will look at you like, what? And I'm like, yep, didn't leave the house for a couple of years. And so it really takes on a perspective. And then again, when the young person talks, it's just an amazing transformation. You can tell I love this program. It's also evidence-based. Dr. Otto Wall has done a study, and CUNY has also done a study that improves student knowledge and the reduction in negative stereotypes, as well as an increased willingness to seek help for mental health concerns. And that's really important, that they're just not going to suffer in silence, that they are going to reach out, and if they hit a door, to keep going and keep asking. NAMI in Our Own Voice is another passion of mine. I'm also a trainer for this, and teaching people to share their stories, and effective stories is so fulfilling. So it's a 60 to 90 minute presentation. And again, to change attitudes, assumptions, and stereotypes. And what it is, our individuals are sharing their personal story and going in a sequence of what happened, what helps, and what's next. So you get to see the story of, when I didn't have a diagnosis, what happened when I did get a diagnosis, what has worked for me in relationships or with a provider, and then what's next? What is that individual's hopes and dreams, and what are they doing? And who is this for? It's for everyone. Everyone throughout the community. We've done it for mental health professionals too, and for peers. It's great for peers to share group wisdom and to see maybe some things that are working for others that maybe haven't worked for them, but to know that there's other things to keep trying, and to know what recovery for yourself looks like. Again, NAMI in Our Own Voice is evidence-based. Dr. Otto Wall, again, has done a study. And some of these things, this is being an In Our Own Voice trainer and seeing umpteen amounts of In Our Own Voice presentations. I love hearing this. I can't tell you how many evaluations that I've done in the last 10 years that say you 100% erased any stigma I used to associate with mental illness. And I learned that mental illness isn't what I see in the books I've read or in the movies that I've watched. And another eye opener is mental health staff saw recovery as a real option, which is that's big also, you know, being able to recognize that the individuals that I'm helping, how they see recovery and what their recovery is totally different than what I'm thinking. So if I'm helping them to get out of bed and take a shower one day a week, that is recovery, and that is a positive step. We have NAMI Family and Friends, which is fairly new. It's a 90-minute or a 4-hour seminar that informs people who have loved ones with a mental health condition how to best support them. So this is kind of taken the bits and pieces of some of the classes that Anita spoke about, especially family and family to family. But we've broken it down into shorter seminars so that more people can attend or can take it before a family to family class opens up. Gives you an understanding of the diagnosis, talks about communication strategies, focusing always on self-care and crisis preparation, and then providing community resources, NAMI and community resources. Another newer program that has come out is NAMI Sharing Your Story with Law Enforcement. And what this is we are training individuals to present to law enforcement, where they can share their story of their own crisis experience and what the interaction was like with law enforcement as a result of this crisis. Again, putting it in perspective to help officers understand not only what the individual is going through, but what the family is going through. So being supportive on all of that and understanding the reactions. And again, letting them know about recovery and that they're not just people that throwing away with justice involvement, that there's other options than just going to jail that day. And again, who is it? Law enforcement. We use this a lot in crisis intervention training, learning panels, that's a nice new word, panels, and other events where we're talking about crisis response or crisis response. Now, these often people think are not part of our NAMI programs, but they are. We have our NAMI support groups, which follow a structured model. People are trained to be facilitators. And again, they're peer-led and they are offered free. And they offer a safe and a confidential environment to share experiences and group wisdom. The process, the model makes sure that everyone is heard, everyone has a voice, bringing people always back into the present. And the facilitator is not a therapist in this group. They, again, draw on group wisdom, know how to de-escalate, or taught to de-escalate, and just keep the group moving. And again, make sure that things are safe for everyone and that everyone's voice is heard. So we have 2 support groups, and one that is NAMI Connection, and that's for individuals who have a diagnosis. That's available in Spanish. We call that NAMI Conexión. And then we also have a NAMI family support group, family members, significant others, friends of people that have a mental health diagnosis. Again, available in Spanish. Let's see if I can get this one. Grupo de Apoyo para I can't say that one. Familiares. Yes, my tongue wasn't going to allow me to say that. De NAMI. And with that, I think we can wrap it up. I'm looking. Woo, I'm a minute over. I told you we like to talk.
That was awesome, lady. Thank you so much. I have a question. I think this is for you, Anita. Am I correct in understanding that the NAMI Family to Family ed class introduces the concept of assisted outpatient treatment?
Say that again. You cut out just a little bit, Betsy. I'm sorry.
Sorry. Am I correct in understanding that NAMI Family to Family, I believe, introduces the concept of assisted outpatient treatment?
Yes,
right?
yes, it does.
Okay.
Yes, it sure does.
And is there an opportunity for local communities to bring somebody in to talk about those programs, or not really?
There absolutely is. First and foremost, I would go to the state organizations. And if you want somebody to come in local, they can refer you to any of the local affiliates that would be willing, or the state would probably do it themselves if it's done virtually.
Right. And I'm thrilled about the NAMI provider training. That's a fairly new one, isn't it? I'm not familiar with that one. Yeah, I know one of the things we run into often in dealing with assist outpatient treatment, because we're dealing with folks who are really, really quite ill. They're kind of caught up in that revolving door of hospitalization and incarceration. And we often hear sometimes providers saying, oh, their families have given up on them, or they've burned those bridges, and just sort of like they seem to be, in my opinion, a little too quick to write off the family. So I love the idea of reminding them that the families are still out there. They want to be supportive. Sometimes they do get exhausted and need to take a step back, but it doesn't mean that they can't be re-engaged down the road as their loved one starts to get some of the treatment that they need. So I got to assume that is pointed out in that class. So excited to hear about that. Amy, I know you've been monitoring the Q&A agents for our panelists.
Muted.
I also want to say, as a former provider, how excited I am about the NAMI provider. And as you talked about it, it sounded like it was mostly educational institutions that were taking advantage. Are mental health providers are they being marketed to? I mean, I think this would be invaluable for them.
Yes, they are. And now what's happening, now that we have shorter formats or formats that they can do self-paced, so there's different options. The 15-hour seminar was harder for that, where you can do that in universities, can't always do that on your job. So yes, they are now. And all of those different types of seminars are being offered. In fact, they should all go live. Well, I have to finish doing the proofreading, but they should all go live very soon.
And are there continuing education credits available for those?
Not directly through national at this time. However, the NAMIs, wherever they're offering it, they can go through their local accreditation and they can get credits for that.
That is just so awesome. So our friend Leslie says that there's a 4-hour seminar of provider that she's been teaching in Iowa for several years, and it's her favorite.
Iowa, yes, you have, and you can let everybody know how that's going.
Here, let me open your mic. Just a minute, Leslie.
I can't believe we have somebody on here from NAMI, Iowa. That's amazing, because I know you're working with Darren a lot. So
we are. Thank you very much for mentioning it. We love teaching this. I've been teaching it for several years, and NAMI Iowa now does the coordination of it. And I wanted to answer Amy's question that we had been teaching it to professionals already working in the field with experience, several agencies, several things like Unity Point, etc. And it is well received. It's especially powerful because they get to see the person with lived experience, the family member, and the mental health professional cooperating in their mode of teaching it. And there are lessons in and of that in itself. I can't say that enough. And it's also very helpful in terms of them seeing people when they're at a time when they're doing well. Mostly, a lot of these people only see us when we're in crisis. So that's one of my favorite things about it. And we always try to couch everything from the point of what could have been done better or what really was helpful, because we have to be very careful not to have it be, forgive the word, not to have it be a bitching session. We want it to be something that helps to share examples, but give good tips for what they could do better in the future.
Thank you, Leslie. I'm so glad that you were able to share that.
Me too. Bonnie asks, do you have to have two people present in our own voice?
Yes. Yes. You should. We never send any of our presenters or even our leaders out by themselves. Anything can happen. So yes.
All right. Please restate the 12 names and 6 that are EBTs, evidence-based.
Do you want to answer that one, Anita, or do you want me to do it?
I'm gonna peek though.
You want me to share it?
I'm just gonna, on the PowerPoint?
Doesn't matter. I don't have to go and find it. You can say it.
Okay, so our evidence-based, we have NAMI Basics, NAMI Homefront, NAMI Family to Family, NAMI Peer-to-Peer, NAMI Provider, and those are the, what we call the classes. And then we have, let's see. So for our presentations, and I believe NAMI Ending the Silence, and that is also evidence-based. NAMI In Our Own Voice, and that is also evidence-based.
And you've got it.
NAMI,
Oh, go ahead.
huh? Oh, no, I'm sorry. NAMI Family and Friends. That's, I lovingly refer to that as the crash course of NAMI programs. We have NAMI Sharing Your Story with Law Enforcement. And then we have our NAMI support groups, which are NAMI Family Support Group and NAMI Connection. Did I get them all, Susan? Did I miss anything? I think I got them all.
So
Yeah, I think you got
Jennifer,
them all.
yeah, Jennifer says that she's interested in the NAMI telling law enforcement story. Do you know, is anybody doing this in North Texas?
I don't know, but I would assume that that the best contact would be NAMI Texas.
Mhm.
You know, I have a question about that particular training or presentation. I mean, I'm thinking that might be something that our AOT Learning Network might be interested in, because we often get folks who have been through AOT and had a really, positive experience and want to share that experience with others afterwards. And I'm just wondering, maybe, teaching somebody how to share their story is something maybe our folks might be in. Is that something you would?
Yes, well,
You would do sort of on a national basis.
it's an online training.
Okay.
So if we could connect you with a local affiliate or the state affiliate so that they can recommend you for the training and then be able to support you if you were going to go out and do the training or the presentation, sorry.
Okay.
Is it possible to purchase the manuals for these NAMI classes?
I'm gonna let Anita say that.
She knows I'm the heart. It is not possible to purchase them unless you are a trainer, a leader. Participants never purchase the manuals, but you typically, if a class is going on, either the affiliate or the state will purchase the participant manuals for them. But no, all NAMI materials it's either copywritten or copyright. I'm not sure the correct way, and they are not available unless you are a trained leader or trainer. So sign up to take NAMI Family to Family, NAMI, sign up to take the classes, and that's how you get the manuals.
Are these seminars available to our local law enforcement?
They're available to anyone that contacts a NAMI. And if they want to have any of those presentation programs, they can come in. And again, if you don't have a local NAMI near you, you can contact the state. And a lot of these programs, people are still doing them virtually. So if that's something they're interested in, if we don't have local people, then we can do them virtually. If you're running into a wall and can't get anything, you can always contact either Anita or I, and we can work within that state or maybe through another state that can come in virtually and do the program for you.
So cool. So Mark Gale has a comment, and Mark, you should, your mic should be open.
Two things on, so I'm criminal justice chair of NAMI Greater Los Angeles County. I'm the principal author of the training program that Sicily was built on. Shannon Scully observed our training program and turned our training program into an online format. I can't see I don't remember everything that was in your slide, but you missed one of the most important points. You know, it's not just about how to craft a good story or testimonial. You can take a really good in her own voice presenter who does great presentations in the community, stick them in front of the toughest audience in the world, just 24 cops, and not have it go well. And we created this because we felt it wasn't fair to NAMI presenters to put them in front of law enforcement without some preparation. And I had actually gone to Sam Cochran and said, have you seen any kind of do's and don'ts, preparation, tips for people to do this properly around the country? And he said, no, nobody's ever done it. So for 20 years, we sort of were winging it. Now we don't wing it anymore. But the point is still peer safety and officer safety. So what our program does, we're the emotional impact, we're the emotional face of mental illness. We put an exclamation point on a formal curriculum of de-escalation. And I don't think CIT would work nearly as well, nor would the officers remember the material nearly as well without hearing from us. And they never get to hear from a peer who's in recovery. All the peers they come in contact with are in crisis. So it's important to know that somebody can be in recovery, what that looks like. And it's also an opportunity for a peer to say, here's what the officers and the deputies did correctly, or here's what the officers and deputies did incorrectly, but in a way that won't get the presentation shut down by the supervisor in the room. And we go over that. So, but in the end, the program's there to save lives. We've had too many shootings, especially in Los Angeles. There's too many people who are no longer here because officers didn't handle the situation correctly. And the emotional impact that our folks make is, you know, they don't remember the PowerPoint on the 5 symptoms of schizophrenia, but they will remember our speaker who told them what it was like to have schizophrenia. And it drives the training home. So number one, I think that should be part of your slide. It is saving lives and safety for both peers and officers in the field. My other comment on NAMI basics, Anita, just like you, I had to send my juvenile to a locked facility school before they were 18. And I haven't looked at NAMI basics in years. Originally, there was no description of the ADA or what FAPE means, you know, a free and appropriate public education, and what your rights were. So I never was trained to teach it, but I would talk to families and have them Google summaries of the ADA to help them understand it. So I hope that's part of it. But one of the very valuable things that's in it are the PTIs, the parent training institutes that are funded by the ADA. I don't know if that's in NAMI basics, but if it isn't, you should include it because they have access to free lawyers. And sometimes if you've got a difficult IEP going, that's really helpful. So thank you for your time.
Thank you for that, Mark. We are getting ready to actually do some updates. So I just jotted that down. Yeah. And I thank you.
Yes, thank you.
Yes.
Oh, you're muted.
Amy?
I love how she says, of course I am.
Anyway, I think the PTIs are really helpful. You can't always find an advocate, you can't always hire a lawyer,
Right.
but here's free lawyers.
Thank
And I learned about it from the Disability Rights Educational Defense Fund folks. And I didn't know they existed 20 some odd years ago when I was going through this. But, and you can actually find state charts and listings of where all the PTIs are. So whatever state you can get, it's a handout. You could give it out to people. Here's the phone numbers of the local PTI, and they're really helpful.
That's great. That would be a great handout in class 5.
And so thank you for your time.
Thank you very much.
So Bonnie has a couple comments. She says these families are absolute lifesavers. I've been teaching family to family for 22 years and basics since it came out in NAMI Smarts, and that the state of Georgia has been using in our own voice for CIT for years. Now I know as a practitioner, when I was involved in our CIT training, we had people with lived experience present, but they were not necessarily trained through in our own voice. And I think that was, to be honest, I don't even know if in our own voice existed, but it would have been helpful for them to have some preparation. Still very impactful, but Jane wants to know what's the best way to encourage law enforcement to participate in the program. And if anybody has the secret to that, I want to hear it.
To have somebody like a spokesperson that is a peer for law enforcement. Something that we just heard, Mark, somebody like that would, I mean, to have that sort of collaboration. You just can't walk in the door and tell people you need this. We know that never works for any groups, right? So finding a peer advocate that would help.
And I think if you're having trouble finding a peer, a CIT trained officer would be a good place to look. Oh, Leslie says snickerdoodle.
I love cookies. As soon as I saw snickerdoodles, I love cookies.
Snickerdoodles and good relationships. Mark has another comment. Hold on, Mark.
Well, you know, we were invited by the Sheriff's Department because we had worked with the Sheriff's Department for a long time to do this. But I got to tell you, if you have a resistant police department or a resistant Sheriff's Department, if you want to just get to the meat of the matter, ask them in their budget or look up their budget and find out how much the county spent on excessive use of force litigation last year. And when they spit out a number of many, many millions of dollars, you say you'd save that money by properly training your officers. And you could take that money and put it into further training for your department. The money could be spent in the community. You know, you could use it to help reduce the people with mental illness in your jail. But spending money on excessive use of force litigation is just a complete waste. And CIT will help you bring those figures way down. And that usually hits them where in their pocketbook. That's where it hurts.
That makes sense.
Any more questions, Amy?
Oh, I didn't scroll down far enough. What's the best way to have churches to sponsor trainings?
Is this for the Sicily or?
Let's go back in.
I think any of the programs. How do you just think, how do you get?
One of the things, so first again, is meeting with the groups that meet at the churches. And that's generally where it starts first, is one of the smaller groups. Putting classes in bulletins, that old way, And then people asking, what is this?
Mhm.
So that classes might not be offered by the church. Going to, well, even just going to, and it has nothing to do, but going to chambers of commerce, talking about what programs are offered here locally, bringing in people with lived experience, family members and individuals. That again is what opens doors, people's personal stories.
Last call for questions.
Who's from Pittsburgh, PA?
Raise your hand if you're from Pittsburgh.
I just left there about a year ago and moved to North Carolina, so.
You're unmute. Community Revitalization Mission.
That's okay. We probably got you in a car or something. We're sorry. All right. Good to see you, Pittsburgh. There's my shout out.
Well, thank you, everybody. Really appreciate your attending, and more importantly, really appreciate Nita and Susan sharing this really vital information about NAMI. It wasn't until this summer that I realized that there was actually research on these programs, and I saw an article on Psych Services on NAMI basics. So that's what got me thinking. So again, thank you so much for presenting for us. And if you have any other questions, we will forward them to our speakers. You just email them to any of the three of us, myself, Betsy, or Brooke. We'll also be sending out the slides, and there is a contact. I saw an email in there as well. So
Thank you.
thanks, everybody. Have a great rest of the week. Bye-bye.
Bye.
Thank
Thanks,
you all.
everybody.
Bye-bye.